Dr. Mehrzad Zarghouni, Vascular Interventional Radiologist at Vascular Institute, as well as Kelsey Resler, Wound Care Certified Nurse Practitioner at Advanced Wound Institute, are here with us. They have joined forces to integrate a toe and flow model in any office-based lab or outpatient clinic-based setting, and have seen impressive results so far. So we're really excited to discuss the success that they have seen as a result of implementing this toe and flow model. Thank you so much for joining us.
Thanks for having us.
So if we can talk to you first, Dr. Zarghouni, about why is it critical once you restore blood flow to be able to have a wound care specialist ready and able to debride a wound? How does that work? Why does it need to be done right away?
Right. Basically the best timeline that we've seen with patients with debridements is within 24 hours of restoration of blood flow. You're revascularizing, the vessels are widely open, you debride the wound, you get the most wound healing and the best long-term results. Now, you could get the slough off, you get the clean the infection, and you're not gonna hurt the patient, because if you do it before or even months after, you're gonna miss your timeline, you're gonna miss your window of opportunity, really, to get the best result from your wound care and debridement.
And Kelsey, from your perspective, from a wound care specialist perspective, talk about why this is important.
The wound can only heal from the inside out in most cases. And so if you're not addressing the underlying concerns before you're addressing the external, what we visually see on a wound, it's never really going to heal how you want it to. And so getting those in at the same time really helps heal wounds. But then in addition to that, if we address the underlying problems, it really helps prevent wound healing, which is our end goal. We don't want to be in business doing wound care, but someone's got to do it. And so we're here, but we don't want our patients to get wounds. So if we can prevent it ahead of time, it would really help with any overall wound healing in the forefront.
Does it need to be in the same building, such as at a hospital, under one roof?
It certainly can, and traditionally that's the way it's been done. However, really the success of that model is because of the availability and close communications between the providers and practices. I can get a CLI patient, identify them, have them be seen in Advanced Wound Institute within the same day or even hours, and vice versa. So I think such a collaborative partnership with patient care is critical to be able to prevent limb loss and heal these patients in a timely fashion.
Kelsey, how does it work normally without having this synergistic relationship?
So normally we see our patients once a week. They come in, we debride wounds, we do the wound care here, whether or not we send them home with wound care supplies or set them up with home health, who kind of does it supplementally throughout the week. But we can only do so much to a wound without getting the vascular or the lymphedema aspects or, the underlying swelling and circulation problems addressed. And so without that aspect, we do our wound care the same, but it works a lot of trying to get them in the weeks in between to see their vascular provider or their PCP to even get that referral set up. In most cases, is a lengthy time. And now that more offices are opening up, there's less availability for patients to get in to see their vascular providers because there's such a high demand. And so with these patients coming in, being able to see not only wound, but hey, here, right now we have your vascular provider. We're going to get you set up, let's do these ultrasounds. Let's see if you've got any blood flow problems right off the bat. Really helps patients from a wound standpoint, but our wound care is essentially the same. It's just really helpful in getting them in and getting that vascular consult right away versus having them wait 6 to 8 weeks to get in.
Right, and you can't guarantee that a patient is even going to follow up afterwards. Right. They come in to see you, right? One of you. And then they're like, oh, well, at some point I'll make that. With this, they can do it in one spot, make the appointments at the same time. You create a synergy. It's all the same network in a sense online. So the front office person can say, okay, hey, wait a minute. You're logged in here as having also a non-healing ulcer. We need to get you in. You're coming in on this day. Go see the wound care specialist on this day.
Yep.
Exactly.
And of referrals, and I wonder how much referrals and insurance were a real hindrance to getting the right care for these patients before, but now with these synergies, do you
Right.
find that you don't have these the insurance and referral obstacles in front of you?
100%.
Yeah.
Go ahead.
Definitely.
Dr.
I mean, yeah, sure. So you would see a patient, for example, in wound care or vascular. You have a vascular guy, or you have a wound care specialist that works with you closely. You send the patient to him. Sometimes they're able to see him in clinic and not be able to do any procedures on him. And you won't find that out until the patient shows up to the appointment or you go through the process. So time lapses, these patients are critical. In a CLI patient, you probably have a few weeks or days to revascularization depending on the presentation. So any delay definitely delays wound healing, leads to poor outcomes, leads to amputation, and further health risk with these patients.
That's actually another good point, Dr. Zarghouni, that you don't know if a patient's is following up with their wound care specialist, and you can't guarantee that they're going to be able to get an appointment with that wound care specialist. Having your own wound care team that's synergistic, you can guarantee that you're going to be able to get that patient in for that debridement in a timely fashion, to your revascularization.
Right.
Kind of touching base too on something I don't think a lot of people really realize, but I've noticed a lot over the last couple of months that we've been working so closely, is that a lot of times when they go in for these procedures, they're wearing compression wraps, they're wearing casts. I mean, if they've got, venous insufficiency, they need that compression aspect 24/7. And so then they go in, they get their procedure done, and then no one's there to rewrap appropriately, do their wound care. Everything's taken off, they're scrubbed in, the procedure's done, and they're like, okay, now who's gonna wrap them up? So it's really nice to also have those little side bars where we can pop in and say, hey, we'll help you out, we'll put this on. Even if they do see a different wound care provider, touching base with them and saying, hey, we ended up reapplying that Coflex multi-layer wrap today for you before they can get in and see you next Tuesday, because we were able to do that vein ablation, we were able to do that angiogram and restore their blood flow. So kind of making those connections with the wound care and vascular in ways that you wouldn't necessarily think right off the bat.
It's interesting you pointed out that to make sure that they rewrap the wound in a proper fashion, because we had a patient just today that went into the hospital, and a general nurse ended up unwrapping so the doctor could see it, and then she ended up rewrapping it, and she wrapped it too tight, and her leg, she sent me a picture, it was just unbelievable. It was like she had a target, on the bottom of her, on her leg, and it was just awful. And so having that wound care specialist, someone who really knows how to wrap these wounds as a specialty, highly trained, I think is critical to overall care.
Definitely.
I certainly agree. Someone who knows the patient, right? Someone who's seen the patient, with our wound care specialists, I mean, they know the patient from the beginning to the end, and they follow these patients. So maybe a certain amount of compression is appropriate, and you have like your example, you have a patient who's seen a nurse who's not familiar with the patient, they wrap him too tight, they hurt him from a vascular standpoint.
And you can also, we find a lot with these patients, they do have, some of the patients that are venous are also arterial in terms of what they're presenting. And it's amazing that you'll have a wound care specialist that will end up saying, hey, you need compression socks, and then they go to their vascular specialist and they're like, oh my god, no, don't do this. And so having that synergistic relationship where you can talk together to know that they not only have something venous but something arterial, and maybe compression socks, or maybe a lower level of compression, maybe simply a diabetic sock might be more appropriate, but you have the joint records, so you can make sure that they are getting the right care for them. And so would you mind going through some examples of how your team has really come together? Kelsey, you've been at the foot of the bed in an OBL, in a cath lab, right after a patient had been revascularized by a vascular specialist. Can you walk us through what that was like for the patient?
Oh, my favorite is we had a gal with a black toe and came in and only came in for a wound, was not here to see vascular, had already had a vascular consult within the last year, but she knew something else was wrong. She wanted to get her wound looked at. And so blood was restored in the OBL, and we're there. I mean, she had multiple other wounds as well, but getting to be able to debride those wounds now that there was adequate blood flow, you're debriding and there's blood coming out of it. And that's sounds awful, but that's so exciting, because when you're debriding and nothing's happening, you know that wound is never going to heal until that blood flow comes back to the site. And so when you're actually there and the blood flow is now flowing, and it's a sign that, you know, it's a sign of hope really for the patient that, hey, not only are we going to really work hard to get these wounds healed, but now you have circulation to your toe. So I want to say maybe a month went by and her toe is completely back to being normal, happy, healthy. All the blood flow pretty much took away all the necrosis that was there. And it was mild wound care that we were doing, nothing too crazy after that. But it's really hopeful for the patients too, because, you know, they get told, well, your only course of action wound care wise is to get that amputation of your foot or even your BKA. And so when they hear, hey, not only do you have blood flow, but we're going to heal these wounds, you don't need to lose your toe, you don't need to lose your foot or your leg, I think really saves a lot of people's lives.
And Dr. Zarghouni, it must be a real relief for you when you're finished revascularizing and you're going, okay, well, do I enough? Do I need to do more? I mean, because what you're looking at under those x-rays is really under the fluoroscopy is, you know, a 2D image of a 3D leg in a sense. And so it's one thing to restore the blood flow, but it's another thing to know that the body is actually using that flow, that it's increased perfusion and it's going to heal the wound. And if you have a wound care specialist at the foot of the bed, such as Kelsey, and she's debriding it and blood is flowing, you know, I could almost, you know, see fireworks for you.
Exactly. One of the biggest joys is when you have a foot who has been devascularized for a long time, chronically, you know, non-healing wounds, basically like a desert foot, and you open the vessels, either one of the tibial vessels, and you have good flow going down there. You have a wound care specialist going with the curette, debriding a little bit, and blood starts coming out. That's a wonderful feeling, because, you know, for that patient, you've prevented a major life event. You know, not only the wound is going to heal, they're not going to get amputated, they're not going to have to go through a process of, you know, being immobile and having to figure that out. So it's very, you know, rewarding to have that and have a wound care specialist working with you in that environment, because you get immediate feedback.
Exactly. And so let's sum up here in terms of having a toe and flow model in an office-based lab setting. Let's run through those benefits, each of you.
Initially, it's very convenient for the patients, you know, not going through the hospital, especially with this era of COVID and the pandemic going on, being able to have key relationships with wound care specialists such as the Advanced Wound Institute. We're able to work together synergically and really quickly, and being able to provide, you know, patient care inside out and outside in the same setting, making sure the patient has appropriate follow-up, appropriate long-term care. So I think that's very beneficial as far as in a timely fashion, as far as convenience for the patient. And also, we are doing a lot of cost saving compared to big centers.
When you sit down and you actually talk with your patients about what they want from their care, they just want the truth. And so I think oftentimes, you know, healthcare has gradually gone into the system where you're in and out the door and you don't know if you're seeing a nurse practitioner, a doctor, what they do, what they're doing, and you leave with a prescription and you're kind of in a blur. And so it's fantastic to have that portion of education where even sometimes I'll grab one of the providers, the vascular providers, and we'll both walk in there. We're like, we've got to target it from so many facets that, you know, this is going to get really confusing for you really fast, but we're both here and we're both going to specialize in what we do to heal it. And have that ample opportunity to ask their questions, and they say, oh, let me grab my wife from the car so she can hear all of this. And it's really rewarding to hear that feedback back from our patients, that not only are we having those, uncomfortable, awkward conversations with them, but doing it in a way where, hey, we're going to have this conversation, but it's not just me that needs to hear this. It's your vascular provider, it's your lymphedema specialist, your physical therapist, your home health. I mean, all of these come together to really heal patients. And I would love to have a magical thing to just throw on a wound and it heals every time. But unfortunately, it's one of those spectrums where you need to pull in all the arms that you can. And I think our patients really appreciate that, in that we have it all under one roof and they don't need to travel to 15 different locations. A lot of our patients, I mean, even with COVID, but being bedbound or having those transportation problems, I mean, geez, transportation sometimes can take 6 hours. So being able to come here, get everything done, and then transport home is, I think, really going to help.
Thank you so much. We really appreciate you, Dr. Zarghouni. Kelsey, thank you for all you do.
Thank you
for having us.